Getting ready to do Intacs surgery on this young man. Intacs are these little semicircular rings that we put on the cornea, into the cornea to make it go from looking like a cone to looking flat. Look at the center of the line, my brother, right there. So what this machine does is it inserts the rings in those tunnels. It's incredible how fast it is and how easy and how accurate. What it's doing is making these tunnels inside the cornea. And that's it. How you doing? One of the other advantages of this machine, aside from the fact that it'll tell you we can tell it where to put the rings and how deep and in one position, it also, and the centration of it, it also goes really deep, right? So with the older technology, we can only stop at 400 micrometers. But with the ZA, we can go as deep as we want. So in your case, we're gonna go 460, which is about 80% deep into the corneal depth. So that makes a big difference. You know, that one, it improves more astigmatism because the deeper you go, the more correction you get. And number two, it prevents it from coming out. So a lot of people in the olden days, I've seen people who had surgery by other doctors, never mind, by the way, but they've had it by other doctors or in other countries, and the rings come out because it was put too superficial. This goes all the way deep in there, so this is as good as it's gonna get. This machine doesn't give people hemorrhages on their eye. The older technology used to give people self-plunge hemorrhages, so they would come the next day and the eye was all red, full of blood. Yours, nothing, not even a drop of blood. Good. Now we are ready to insert these Intacs rings for this young man. So as you can see, please look at the light for me. As you can see, the tunnels are already made. There's a tiny incision made right there at the 180-degree axis. And all I'm gonna do is I'm going to put these hot dogs inside the pita bread. It's pretty cool. Yeah. Easy peasy, lemon squeezy. It's just so beautiful and effortless, right? Takes all the skill away. So I don't need to use my handiwork, you know. And it goes right into the pot. Okay. That's
Got it.
beautiful. No pain, right? You are doing amazing. Yes, per favore. Center the line. Look at that place. Love it. Good. Some people put one stick, some people put two, some people put a straight stick, some people put a bigger egg. I don't think it really matters. As long as you keep the edges the approximated. Beautiful. Antibiotics. Look at the line, look at the line. And we put a bandage contact lens just to protect the cornea. Easy peasy. Lemon squeezy. How do you feel? Good? Yeah. You're done with the right eye. Feeling okay? These contact lenses have zero power, so it's just a bandage over the cornea until it heals. To be honest with you, with this technology, you really don't even need them because you don't even have a scratch on your cornea. It's a beautiful, beautiful technology.
Feel great.
Good. What time is it? Well, this is huge. You can see those,
Yeah.
no problem. You can probably even see
blurry, but I think it's
Oh, absolutely, yeah. He just had the surgery, but it's really remarkable how quickly the vision improved. How do you feel, young man?
Feel great.
How long has it been since the surgery?
I would say maybe 2 minutes.
2 minutes, fine, something like that. What, you're blurry, but you can already see some of these, right?
Yeah, Z, C, D.
Good.
K, S, R, O, H.
Good.
C, D, Z, K,
Yes, sir.
Y, or U. R, H, C,
Yes.
S, Z. O, Z, T, G,
Here.
K, R, H.
Yeah, and it goes in and out, so I don't want to push you too much, but it's been, yeah, you might even see those. So someone who's been wearing glasses and contacts and all this for many years, and I have people even worse than you who come after Intacs immediately. You can drive, like it's crazy, right? And the vision keeps getting better. This is just the beginning. Your corneas are all swollen, full of medication, full of proparacaine. It has a contact lens bandage on it, but congratulations. It's really
Thank you, man. Thank you. I appreciate you.
My pleasure.